The vast majority of patients attending a symptomatic breast clinic do not have breast cancer. Only around 3% of patients attending one of these clinics has breast cancer, but understandably they cause a huge amount of anxiety. Hi, my name's Adam Critchley. I'm a consultant breast surgeon and I work at the Royal Victoria Infirmary in Newcastle upon Tyne, and I also see private patients at the Sheffield Hospital in Jesmond, and I've been a consultant since 2013. Today I'd like to talk about the symptomatic one-stop breast clinic that I run at the Newcastle Hospital in Jesmond. This service is open to all patients who have a variety of breast symptoms, be that a breast lump, nipple discharge or unexplained breast pain, and understandably these symptoms cause patients huge amounts of anxiety and they want to get to the bottom of things as quickly as they can to often help their mental well-being. When I see you in the clinic, I will take a detailed history and also perform clinical examination. Following this, I will explain to you if I think that you would benefit from some breast imaging, which will be performed the same morning, immediately following my clinical examination. My imaging is typically performed by Dr. Alan Redman, who's an extremely experienced consultant breast radiologist who works at the Queen Elizabeth Hospital in Gateshead. Depending on your age, some patients require both a mammogram and a breast ultrasound. Some patients require just a mammogram or just an ultrasound, depending on the reason for you attending to see me. Dr. Redman will give you the results of the scans immediately following having performed them, so that when you leave the hospital that day, you will have a clear understanding of the outcome and the next steps. The vast majority of patients attending a symptomatic breast clinic do not have breast cancer. Only around 3% of patients attending one of these clinics has breast cancer, but understandably they cause a huge amount of anxiety, and trying to identify the small number of patients with breast cancer is extremely important, but also reassuring that much larger group of patients that don't have breast cancer that they have nothing to worry about is also extremely valuable. A small number of patients will require an ultrasound guided biopsy, and Dr. Redman will take your verbal consent for this if required, and he will perform that with the utmost care. A biopsy result typically takes around 7 days to be assessed in our pathology lab, and I will then need to arrange a follow-up visit to discuss this result. The vast majority of patients I see in this clinic are discharged following my assessment, and no further follow-up is required.